Thank you everyone for joining. Yeah, thank you everyone for joining. It's a privilege to spend time with you, and let's dive in. So it's a privilege to talk to you about our joint PhD program across both UCSF and Berkeley called Computational Precision Health. Next slide, please. So today we're going to walk through a bunch of stuff, but to kind of give you just a quick layout of the agenda. First, we're going to talk about kind of like what is our mission, what is the vision of our program we're trying to achieve as Computational Precision Health, or CPH for short. We'll tell you a little bit about like, how do we try to achieve that mission? Like what's the structure of our pedagogy and like what is a PhD program and the people within it. We'll tell you about our commitment to diversity, some highlights of the student experience and the actual faculty you get to work with to open up for questions. So without further ado, we'll just dive right in, kind of like walk you through the vision. And today we're going to hear from both Serena and I. So I'm Adam. I'm faculty in CPH. I also have secondary appointments in CS and stats, part of like Bear and AI ecosystem, but really my core home is inside CPH. And I've been here now for I guess this is year four since the start. So it's cool to see things grow. And Serena, do you want to do a quick?
Sure, I can do a quick intro. Thanks, Adam. I'm Serena. I'm very new faculty. I just started in July of this year. I'm jointly appointed in CPH and also in the computer science division within EECS. My research is in AI, and I'll be telling you a lot more about that later on.
Oh, thanks. Next slide, please. And we're speaking to you on behalf of our chairs, Ida and Maya, who unfortunately can't be here today, but are all, like the visionaries help build the program, and you'll see lots of them throughout the process. So Ida is at UCSF. She's a primary care doc, has done incredibly foundational work in data interoperability and many things around that space. Also leads Jupiter Health. And Maya is our chair from the Berkeley side. Huge amount of causal inference, HIV, ML and stats. Actually now also has a company doing really cool stuff. And she's in on the Berkeley side, and together they like help both create the program and they're emblematic of our kind of joint bi-campus mission. And I'm excited to tell you a lot more about that and kind of what that vision is and the things that we're trying to convince you to apply for today. Next slide, please. So like I guess like let's start off with a premise and like the where we are in health today. Health is this incredibly complex, super large space of data. We have many, many stakeholders, and across the many diverse problems we want to resolve from perspective of clinical discovery, basic discovery, what we can do as patients, all of these kind of things. The promise of what we can do with computation is not yet being fully realized. Next slide, please. And our kind of core mission, I'm going to dive into more detail in a just very shortly, is how do we leverage all the things we already know. Health is such a high stakes number. We already collect so much information. How do we transform both personal and public health through computation? Now, this sounds big because it is, but this actually means many specific things I want to walk through a little bit together. We'll talk about it first as a general kind of program mission. It'll also become more crisp when we talk about kind of the faculty research overviews. You kind of see the how does that instantiate in my research and in Serena's. Next slide, please. So when I say health data is big, I mean that in like a truly massive scale. So like because things are high stakes, we have a massive health record, we have a huge, like unbelievably large sets of medical images. UCSF alone has petabytes. We have many millions of notes. We have incredible sensors, data not just at the individual level, but across populations. And across all of that, like if you think about what is the standard of care today, how do we arrive to who gets screened for cancer, how do we pick a therapy? We use almost none of it. At the same time, so like the frontier of how we use information to make care better is something that we need to be ambitious in. At the same time, we have a huge family of computational methods that we bring to bear on things that we consider like modern deep learning, AI style methods, the field of data science. And in that space, the frontier, what we need to invent that best use the opportunity we have at hand is also something we need to push on. That's kind of like on the data side and the computation method side. But even that is not enough, right? Like it's not just like we have a method that can solve a problem. We need to be experts in how we think about the right kind of intervention to actually own the outcome and actually drive real change, given those opportunities, all towards the kind of centralized goal of improving health, improving healthcare. And we think to do all of that, to actually improve healthcare and health through reason with the promise of what is the next level of data and computational methods, we think this is a new discipline that needs its own kind of training program and a new type of PhD. And so like that's what we're trying to do. Next slide, please. So I want to talk a little bit about kind of like pillars of things that we believe in, and then kind of like a paradigm of like the type of things you often see in a good CPH PhD. So when we say CPH pillars, there's kind of three core ideas I want to briefly mention. One, we often think of health in the literature as kind of like these little silos. Maybe there's a cancer paper, maybe there's a cardiology paper. Health is always complex and multifactorial, and so we think a lot about what is complex whole person care and how do we think of improving things in the context of people, not individual disease silos. Two, we think a lot about augmented intelligence, meaning the way we practice medicine today is bounded, but what we can do, how do we make the next generation super medicine of tomorrow and augments what clinician can do? And finally, how do we kind of bridge the care setting, bridging clinical and community health together, and kind of breaking the silos between inpatient and outpatient? Next slide, please. This still sounds all very big, but there really are kind of common solutions that kind of pop out throughout each of these types of work. One is a common precision within how we think about problem formulation. Health is very long tail, and so we need to be asking the right questions. And there's going to be a big part of our pedagogy in how do we actually understand clinical context enough and be embedded enough to ask the right questions so that when we solve it, we can make a change. Given the right question, we need to push the frontier what's possible in our solution space, invent the right methods as needed. And finally, given that method, we need to be precise in how we think about creating the right deployment setting to actually drive that change for the kind of impact you want to see. Next slide, please. To do that, we need to world-class, like that kind of mission needs a home. Becca, if you could hit the next slide, please.
Apologies. For some reason, it's not going.
It's okay. It's implicit in the bottom right of the slide, so it's okay. The things we need to do, like, like we need to like house it somewhere where we have the ability to like achieve that mission, kind of make these kind of PhDs happen. And for that, we're housed at both UCSF and Berkeley. So YCSF, just on time, it is a world-class medical school. It is a home of a huge amount of work already with an intersection of computing and clinical care. And as a member of UCSF, you have access to UCSF and UCSF health data. And it's an incredible place to not only build models, but also translate them and run trials. And the health system is excited to push these kind of innovations to help real patients. And at the same time, not just at UCSF, but also at Berkeley. Next slide, please. Berkeley, its own center of excellence. We're part of the College of Computing Data, CDSS, Computing Data Science and Society. We're going to be in Gateway, which is that shiny building you see there that will open next spring. So by the time the next PhD cohort starts, housed with folks in CS, stats, and other centers. And we have a huge amount of cross-section between other areas of excellence. And it's an incredible place to be doing this kind of work. And with that, I want to hand it off to dive into the details, like, how do we achieve that mission? What is the PhD program?
Thanks, Adam. Yeah, that was a great overview. Let me get into some of the more specifics now, which I'm sure many of you are wondering about. Bianca, next slide, please. So the first thing is, how do I get into this kind of program? What does PhD admissions look like? And as you might imagine, given the sort of interdisciplinary nature of what we're trying to do here, we're also looking for students with a variety of backgrounds. So this would include students with more computational backgrounds, maybe computer science or data science majors, students with health sciences backgrounds, ranging from biology, biomedical, biostats, public health, and also people from more interdisciplinary groups. And so usually what we say is we have these three pillars, so biological or health sciences, math or statistics, and then programming/computer science or data science. And we're not expecting you to know all three of those, but ideally we would want students who have at least a strong foundation in two of those areas to apply. And again, this covers really a wide range of majors, including non-traditional paths. Next slide, please. So when we look for, students and applications, we're doing this sort of holistic application. And so we're not considering just a single number, we're looking at the entire packet. And so what's included in that packet includes your statement of purpose or SOP. And that's where you can really shine in terms of, why do you want to do a grad school and what do you think you want to do in grad school? What sort of research would you want to pursue? What kinds of labs are you interested in CPH? You can mention specific faculty here who you might want to work with. So that's the statement of purpose. And then the personal history statement is a chance to talk about how your personal background and experiences have influenced your decision to pursue a graduate degree. And so you can cover any number of things here, including, for example, overcoming barriers to access higher education, or your academic service in terms of broadening participation in STEM, or in health sciences. You'll also want 3 letters of recommendation. And so these will come from people who work with you, who know you, who can speak to your skills and your background. Academic transcript, as you might expect, relevant coursework. And so relevant coursework here is really related to the areas that were described on the previous slide. So things related to health sciences, or statistics or math, or programming. Research experience is good to mention, but it might already be covered in your statement of purpose and your other letters. And if you want, you can also attach a writing sample. So this might be useful, for example, if you don't have a published paper yet that's online, but you might have something in the works that can really showcase your contribution to some research project. Next slide, please. Great. Okay, so you might be wondering about funding too. And so CPH program, we do offer stipends. In the fall, it's around 18,000 for the first fall. And then in the second semester after that, your advisor or your principal investigator, your PI, is going to support you, usually through graduate student researcher appointments, or GSRs for short. And so you have a minimum salary of 47,000, but depending on your advisor, you can also, see if they would cover you for the summer, or perhaps you can do internships over summer. So this is really a minimum. And this appointment also includes full support for tuition and fees, and also includes the non-resident tuition, which is there's a supplemental expense there. And so basically, you can be guaranteed at least this level of stipend, and you shouldn't be paying your tuition yourself. If you maintain satisfactory academic progress, then you're guaranteed this support for 5 years. And that's about the average time that students usually take to get to a degree, although it's also possible to extend based on, your situation for research and your discussions with your advisor. This funding applies to international students, and in fact, we do have a lot of international students in our program. And students with financial need, they can request an application fee waiver. And so I think you can take a look at that on this site, and also maybe contact Bianca if you have any questions there. Okay, next slide, please. I can cover this slide, or Bianca, do you want to say something here? It's all about you.
Sure, thanks. So yes, so I will say that if you do have any questions, then maybe I can come on video here and say hello to everyone. If you do have any questions about the fee waivers, please let me know. I do have links on the website. So under the admissions page, you can find fee waiver for national students and also for international students. But really, I'm here, as many of you know, to help you navigate the admissions process. I'm also here to support you, once you are admitted. We do all kinds of things together. We figure out enrollment stuff, we figure out, funding issues, anything. I am here to problem solve with you. So that's who I am. Thanks, Serena.
Yeah, thank you. All right, next slide. So yeah, throughout your time in CPH, if you join our program, you'll also get to take the CPH courses. The guiding principle of this curriculum is really about learning how to tackle real-world problems in small groups. And so these classes are only open to the CPH students, and it's a small cohort. And so, I mean, Adam can speak to this more, having taught the cornerstones, but these classes are something like 8 to 10 students. Yeah, which is highly unusual, I think, especially in such large universities as UC Berkeley and UCSF. And so getting to tackle these problems with small interdisciplinary teams, and you can have a flexible curriculum that reflects, the breadth and diversity of our students to meet your research and career goals. So the way this looks is that you have 2 years of academic coursework that are both at UC Berkeley and UCSF. followed by 3 years of dissertation research. And the courses that you'll be taking, there's a 3-quarter series. So one wrinkle is UCSF is on the quarter system and UC Berkeley is on the semester system, but we make it work. For cornerstones, we have a 3-quarter series that's really based on problem-based learning, and you also get some of the foundations of computational and statistical methods here. Then you have a practicum, which is more hands-on, talking to clinicians and community health members and department people from the Department of Public Health, where you actually get in-depth exposure to real-world practitioners who are working in the health space. And then you do this doctoral seminar, which is 6 semesters, which is more research focused. It includes things like journal club style reading papers that recently came out, or more senior students presenting work in progress and talks by guest faculty. Next slide, please. So I've covered the basics of the PhD program, but I also really wanted to emphasize our commitment in this program to diversity, equity, inclusion, and belonging. Next slide. And so when we talk about that, what we mean is that, Adam set out this really beautiful overview and our vision of what CPH means. But something to always keep in mind is that these promises of computation for health should be available to all people, regardless of their personal or group characteristics. And this is something that really runs throughout our DNA, from the curriculum to the research to the faculty to the students. And so, for example, when we do CPH training, these research impacts, they need to be equitable. We're committed to promoting diversity, inclusion, equity in all of these aspects. And we also recognize the intrinsic relationship between diversity and excellence, instead of thinking of them as trade-offs, as things that complement each other and make us better. Next slide, please. Okay, and I want to talk a little bit about, our amazing students who are in this program. And so I can give a highlight here. So first of all, we have what's called designated emphasis students. And so these are students who are not enrolled in CPH themselves, but have majors in other areas and declare what's called a designated emphasis in CPH. And so we've had a number of those over the last few years. We're very proud of our 24 PhD students who have been in our cohort. It's really an amazing group of students, and I'll show you on the next slide some highlights of our latest cohort. In the upcoming year, we're anticipating about 6 to 8 PhD students in the 2026 cohort. And maybe that was a question that some of you had of what size we're anticipating, and this is the sort of target size. Next slide, please. Yeah, so we're very excited about these students who joined last year. This includes Curtis Chambers, Stanley Hua, Joy Liu, Toru Shirakawa, Advait Vituri, Jinji Wei, Marcus Moen, Sami Barrett, and Geetha Jayaprakasan. And as you can see here, we have a range of backgrounds. We have Toru, who was a doctor. He has an MD. Geetha is studying more the global health side. We have students who are more on the biomedical side, on the neuroscience side, so really spanning a lot of backgrounds. And we're hoping that this year we'll be able to recruit such a wonderful cohort as well. We're also quite proud of the fact that our yield over the past few years, so that basically means, how many acceptances we give out versus how many students decide to come here, it's consistently been around 90% or higher. And so, we pride ourselves in this fact that this is an exciting program, and I think we are seeing that through the level of students' acceptances. And we hope that continues into the future. We have very diverse students, lots of students who are international, some CA residents, some permanent residents. It is a competitive pool, but we do really include students across a very diverse set of backgrounds, and we're open to many different backgrounds. Next slide, please. And you might want to hear it from the students themselves. So here's a couple of testimonies from our students. Stan, who's in the 2025 cohort, he said, "I am most excited to learn from and shadow clinicians. I believe this experience will provide me with real-world insight into what makes a computational problem both clinically meaningful and feasible." We have Sammy, who says CPH is a unique opportunity to learn from a breadth of technical and translational leaders while pursuing my own interests in depth. And then Advaith says, what excites me the most about CPH is the opportunity to work with experts from both computational and medical domains. I'll be in an environment that allows me to pursue cutting-edge research that is both technically stimulating and clinically relevant. So you can see a lot of these students are quite excited about this bridging capacity from the statistical and computational and data science side, bridging that and translating that into real health impacts, working with clinicians, working with public health experts. And that's something that we try to do in every part of our research. Next slide, please. And you might also be wondering, if I did a program like this, where would I end up? And I think there's a variety of possibilities, again, because it is so diverse and so interdisciplinary. I think there's not one set path that everybody goes on. You could imagine, ending up in academia, like the faculty here have. We had these interdisciplinary paths ourselves. So ending up at research universities, you could end up at a academic medical center, at a research institute, like for example, Microsoft Research. You could also end up in the health sector, so maybe in a health system or at a health insurance company. Also, you could end up working in the public sector, working for a government agency, maybe for a Department of Public Health or the CDC, HHS, FDA, or some sort of NGO or disease foundation or funders, like, for example, the Gates Foundation. And then maybe you would end up in the private sector, especially because of the sort of computational side that you'll be learning, maybe ending up in a big tech company like Microsoft or Amazon or Google. There's also big pharma and there's life sciences, or you're going to be in the Bay Area and there's so much startup energy around here. And so lots of people, starting up companies, starting very, very small. You could be actually one of the first employees at a startup or even found something yourself. So there's a lot of opportunities, I think, given the diversity of our program and also being in Silicon Valley ourselves. Next slide. All right, let's switch back over to Adam, and he'll tell you a bit about our faculty.
Yeah, excited to share more about all the faculty that make up CPH. Next slide, please. So at CPH, we're both small and big. So I mean by that, we have kind of our primary faculty, which were five. Uh, our CPH PhD students, as we mentioned already, we only admit ballpark, say 6 to 8 a year. And so that means the classes are very small, things are very tight knit. But at the same time, we have a broader AGG. That means AGG is like UC lingo for augmented graduate group. So there's many faculty across my primarily appointed in either Berkeley or UCSF. 29, 35 respectively from a very broad range of departments, including CS, stats, dermatology, cardiology, etc., that you could work with as your primary advisor. And so you both get the kind of the feel and the benefit of having these very small, kind of tight-knit classes and taught by our CPH primary faculty. But as your primary advisor for your research arc, you could really work with and benefit from the guidance of really any of the faculty across the union of the two, which is 68 total. So when you write your applications, you don't only have it's not only you can apply to work with the five primary faculty, but really any of the 68 are all possible great fits. And so I'd recommend kind of looking through the website and understanding, whose research are you most inspired by and what kind of CPH PhD would you like to pursue. In addition to having faculty from both campuses, we also have designated emphasis students. That's almost like a PhD minor in its flavor who join in our doc classes, who come from other private PhD programs, who are very excited about CPH and are part of our important part of our community. And so it's kind of get the best of breadth and many great people working across these intersections, as well as kind of a very small class, tight-knit core. Next slide, please. I want to tell you a little bit about the five Type 1 faculty, or I forget what we name things. So Ahmed is one of them. His work has a lot of great things has a more causal tint. He works across many areas, a lot of work in cardiology, but also understanding treatment effect heterogeneity from observational data. Irene, who we've already heard about, who's also uh, our equity advisor does a lot of work in understanding how can we make healthcare more robust, equitable, and fair as a core research direction. Sonia does some great work in physiological monitoring and does a lot of work kind of at the bedside. And you'll learn more about my research in Serina's shortly. Next slide, please. Okay, so let me tell you a little bit about my own lab and kind of give you a kind of a high resolution view of the kind of things that my group does. Broadly, we work in AI for personalized cancer care and a kind of a central challenge across cancer care. So cancer is complex, right? There's like a big flow of things that happen. First off, you each have populations of which we're all existing in the world. And we decide to screen some people before they have cancer. So we kind of see cancer at the right time and can do something about it. Once you have someone in the clinic, we often have diagnosis workflows. So it's kind of complex hierarchical decision making. What do you screen with what, and how do you gather information to get to the right kind of subtype? Given that, we have complex decision making of how do we guide a treatment process. And in every one of these incredibly complex challenges, I have different scales of information. We have the same kind of computational challenge, which is how do we find the right intervention for the right person at the right time? And that leads to kind of a unified methodological vision. Next slide, please. Uh, it touches kind of three things that I'll show kind of the plan here. Is like one, we need to get foresight. Like how do we understand what will happen to the patient in the future from our current state, integrating oftentimes massive gigabyte scale multimodal information. Then we need to like do something about it, right? It's not enough to know. If you know and you don't do anything, you haven't made care better. And then after you do something about it, you need to like prove that it worked. So in the context of my earlier work, we've done a lot of work to understand who's going to get cancer in the future. If you want to catch cancer earlier, the plan is like incredibly simple. It's like, well, when someone doesn't have cancer, who's going to get it and when? That's kind of like the cancer risk part. How do you get foresight? That looks like a core deep learning problem because the information is incredibly large. We can't, it's not all tractable, the tools of today. So you need new kinds of efficiencies, both in real learning algorithms and architectures. Then given some kind of partial information, you need to like do something about it. You need to do planning. This kind of touches on the world of causal inference or reinforcement learning to kind of create new kinds of healthcare policies that don't exist today. Next slide, please. And even when you have that, when you finish the model, you need to prove that it works. And there's huge room for innovation, even the way we think about evidence generation. We've been running some clinical trials. The thing that's guaranteed with each clinical trial, by the time the clinical trial is done, the model is obsolete because we have a better one. So there's even opportunities to make the whole clinical trial framework better. We've been doing some new work in adaptive trial design in collaboration with Ahmedullah. Next slide, please. So to recap, the kind of core research themes that we're interested in, one is how do we kind of improve the predictive capacity of what we can do from all the massive data sets that we have at this incredibly high stake setting. This is often very CSE style work. Given the better predictive capacity, how do we improve decision making, create new kinds of workflows and guidelines, building on this new kind of capacity? And then finally, how do we actually translate it to care, both running trials, making new deployment frameworks? And that's my spiel. And if we do all of this well, we can do really well. But I've had enough time. Go ahead.
Thanks, Adam. Yeah, I can tell you a bit about my research now too. Just to recap, I'm a new assistant professor. I just started in July, and I'm jointly appointed in computational precision health and in the electrical engineering and computer sciences department, or EECS for short, in the CS division. And previously, I got my PhD in CS at Stanford, and I'm also part of the Berkeley AI Research Lab, or BEAR. Do you mind next slide, or just transition? Great. Okay. So my research in CPH is very much around AI for public health. And within that, a couple of directions, which I'll explain in more detail, are first, novel data sources and health behaviors. And so what I mean by that is trying to understand how populations are moving around, population dynamics, population behaviors, decision making, and inferring that from novel data sources, because these behaviors can be quite hard to observe. The second thing is network science and infectious diseases. And so within public health, a lot of my work is around infectious diseases like COVID or HIV or flu, which spread through contact between people. And this form of contact can often be represented as a network. And so you might be familiar with this object. It's a sort of data structure where you have nodes and edges. And so nodes are usually individuals and edges represent a relationship between two individuals. So we can often model the spread of infectious diseases as spreading over these networks. And these networks are really powerful for being able to model infectious diseases in a computational or statistical way. And then finally, I'm not just interested in coming up with these data science and computational methods, but actually deploying them as tools for decision makers, usually public health officials. And I'll cover two of the tools that we've deployed before. And I am recruiting students this year. So I'm looking for 2 to 3 PhD students. I haven't decided ahead of time whether they'll come from CPH or EECS. I can advise students in either program. But overall, I'm looking for about 2 to 3, and they would start in fall 2026. And the kinds of students I'm looking for are a mix of, having interdisciplinary interests. And so they should be deeply interested in public health and social science and thinking about, human behavior. Why do people make the decisions that they do? Trying to understand on the ground how people are moving around and interacting with each other, and then what that means for real world decision making and how do we make more effective and equitable decisions. So this sort of interdisciplinary and passion for real world impact. On a skill set side, it would be great to have, a background in networks and graphs. Not necessary, but nice. Also, a lot of our work has to do with machine learning, usually deep learning, natural language processing, and generative AI. So, for example, our ongoing projects use diffusion models, we use large language models, we use graph neural networks, which have to do with the networks and graph part. And then also a lot of my work has to do with large scale messy data. For example, mobility data from cell phones or search logs or user AI logs. And so dealing with these large scale, often unstructured or messy or noisy data sources and being a sort of meticulous person who can look through this data and find the signal in it and do it at scale in an efficient way. Next slide, please. Yeah, so let me tell you a little bit about these directions. Do you mind just hitting next one more time? Great. Okay. So when we talk about novel data sources and health behaviors are extremely important to understand for public health. So this is, for example, this contact network that I was describing in terms of who is coming into contact with whom, but also behaviors such as vaccines or news consumption, mask wearing, trust in public health communication, polarization, and so on. But these behaviors can be quite hard to observe. And so one of the approaches that we take in my lab is to try to infer these behaviors directly from novel data sources. So this includes, for example, location data from cell phones or wearables, social media, search logs, and so on. And when you work with this data, there are a lot of challenges that come with it. For example, a lot of the time, these sort of behaviors that you're trying to infer are not directly labeled in the data. And so you need to come up with methods to actually squeeze all of that messy data and find the clean signal out of that, building classifiers or unsupervised methods, semi-supervised ways that can scale, and also as you scale to address potential biases in your classifier. Next slide, please. Oh, yeah, that's fine. One thing to note is, in addition to inferring behaviors from novel data sources, lately I've also been quite interested in generating or simulating them with generative AI models. The second strand of research is around infectious diseases. And so once we have these sort of estimated behaviors, oftentimes we can structure it as a network between individuals. So, for example, the contact network. And then the question is, how does an infectious disease spread over this network? And how does that inform then how we make decisions as public health officials? So, for example, these networks can then capture heterogeneous risks between different populations. If you're thinking, for example, of how COVID spreads, it didn't just uniformly spread over everyone, but there are certain communities that were at much higher risk due to whom they were mixing with in the contact network, as well as how often they had to go out. Maybe they weren't able to socially distance as much or able to work from home. So that's one question. Another question, a technical question, is when we deal with infectious diseases, we often have very limited ground truth data. So, for example, only daily cases for an entire city, and maybe just one number for every day. Oftentimes when you use large scale deep learning models, you need thousands or tens of thousands of data points to fit on. And here you're operating in the regime of maybe tens, on the order of tens or hundreds of data points if you're lucky. And so in that regime, how do you build models that are both accurate but also don't overfit and have some generalizability and some identifiability? And then finally, when we're using this sort of network data, even if it is powerful, even if we have, for example, location data from cell phones, you're still not going to see every population equally. So certain groups are overrepresented, or certain locations, for example, different points of interest, will not show up in this sort of data. For example, senior homes or elementary schools are underrepresented because of the populations that go to them. And so when you think about imperfect network data, how does that bias your parameter estimates and also your downstream public health decisions? And what can you do to address these sort of biases and observations so they don't end up exacerbating real world biases? Next slide, please. And then finally, yeah, I'm not just interested in building these sort of computational tools, but actually translating them into real world decision making. So, for example, in the past, we deployed a reopening dashboard for the Virginia Department of Health. And so this speaks to the sort of precision community health part of computational precision health, where when you think of precision, you might be thinking of individuals, but you can also get precision in a community sense, thinking instead of a one size fits all policy where everybody either all locks down or all reopens, here we were able to let these decision makers look at trade-offs between reopening different types of places and predicted infections. And we allowed them to try out tailored policies that would reopen some points of interest more than others so that you can basically exploit heterogeneity and infection risk and reopen some of the economy without shutting everything down while still minimizing predicted infections. Relatedly, we also provided recommendations to the Virginia Department of Health on where to place vaccine sites. So this is when they had a limited budget of vaccine sites, basically trucks that were carrying the Johnson and Johnson vaccine. And using mobility data, we could provide personalized recommendations for different under-vaccinated communities. And we basically showed it matters which community you're trying to target because people's behaviors are quite different. And so if you want to target a certain group, then you can try to place vaccine sites close to the places that they're already visiting to sort of maximize the convenience for getting vaccinated. So that's sort of an overview of my work. I do a lot around human behavior, a lot around data science, and infectious diseases, and deploying tools for public health decision makers. Um, sure, I can take the slide. Do you want me
Oh
to?
yeah, like I forgot on my side. So just kind of recap and close. Your PhD is a incredibly unique opportunity. It's long in that it's like a normal term for 5 years because it doesn't give you time to focus on problems that are like appropriately scaled to be hyper ambitious. It's your chance to kind of transform your research area and to improve health. And that's going to be itself fundamentally uncertain, fundamentally hard, but fundamentally a fantastic growth opportunity. Next slide, please. And with that, we're happy, excited to take questions.
So I do have some questions in the Q&A, and I will start from the top. So someone asked, how important is it to have contributed to a publication prior to applying? How important is it?
Yeah, it's not necessary. I mean, basically, like, what is okay? So, how does our admissions work? Often, like, we have an admissions committee, but often, like, really, the game is like, one of the person you want to be your advisor has to be incredibly excited to admit you and work with you. And what are the game are they doing? They're trying to assess, well, do they think you're going to do amazing research together? Now, if you've done amazing research, then that obviously helps prove that case because you've already done it. And if it's in the closer to the area, it's also an easier thing. But people aren't very narrow in their thinking, So, like, you can do great work that's not published yet, or it's not in a publication, but you impressed that you have a great rec letter, but others know the work that you did. So there's no like one size fits all thing. I would not really worry about it that way. I would think about like it's not like you're preparing for your PC application today. You've been preparing for it for many years in a way. You've been doing work. So just think through like put down what you did and like if your potential advisor is excited about it, then great. It's kind of that simple.
Another question is, can you explain what non-traditional academic paths are?
Yeah, I can give an example of that. Like
Yeah, go ahead.
Curtis, one of the students in the 2025 cohort, has
Yeah.
a traditional academic path. He I actually I forget. Basically, he like a traditional academic path is like do undergrad, maybe go straight to PhD, and you kind of like stay in academia the entire time. He went off and did startups for I don't know how many years. He was an early employee at Uber, did a bunch of stuff, and then applied for a PhD later because he always wanted to do it. And so he didn't have the normal arc, but I think he's going to do fantastic work. So there's kind of many ways to kind of get to a PhD. So it's not like if you didn't go straight out of undergrad, it's like not, it's more about like is it the right thing for you to do? Are you excited? Are you motivated to take on this big challenge? And do you have a great match with an advisor?
Yeah.
Sure,
I think the other thing to mention is we mentioned these areas where we would like to see at least 2 out of 3 covered, like biological and health sciences, and then math, statistics, and then programming. But I think related to that is you can develop those skills, not necessarily through classes, not necessarily through your degree, but if you can demonstrate through personal projects or something else that you have those skills, I think you are still encouraged to apply.
Perfect. We do have someone who raised their hand, so I'm going to open it up to Bashir. Bashir, go ahead.
Yes, thank you for a great presentation. My name is Bashir from Uganda, Makerere University. I have a couple of questions. One, do you have course waivers? For example, if someone has a great experience with research, I'll give an example of myself. I have a master's degree in epidemiology and biostatistics and a bachelor's degree in medicine and surgery. I've done a couple of research. I also have a running grant that has machine learning attached to it, developing machine learning tools. Do you provide course waivers, for example, in statistics, that someone with such a background? The second question is, what is the minimum time of finishing the course? Is it supposed to be 5 years or it can be less? And the last question probably is for Bianca. Does the 47,000 include taxes? Thank you.
Okay, so I guess I'll take the first question because the first question is about transferring courses in, and currently we do not. And so really the only requirements that you have are going to be CPH courses, and so everything else is not a requirement. So there isn't a way to transfer in any, obviously the CPH requirement you'll take here. And then the other question for me about the 47,000. So that is an estimate for the year. If you receive the first semester as a stipend, so that is a non-taxed amount, that 18,250 that Serena mentioned, that's non-taxed. Everything else, the number that you're seeing is the gross amount, and so you will be taxed, and so you'll get to see the breakdown when you receive your pay stub. And I'll let you answer the other question about, I forget, but
Yeah,
the
I
second
unfortunately
question.
also forgot which question
Would
was
you
question.
mind remind, yeah,
Might be
the
number one
remaining
and
question?
three, and then I forget two.
Bashir, can you ask your second question?
Oh, the minimum time to
Oh,
finish the course, is
Oh,
Oh,
it
yeah.
5 years or I can do it in less than 5 years?
Yeah, so the normative time is 5 years. People can graduate earlier. It just always depends case by case of like when someone has done a great PhD's work and also what aligns to the goals to the next stage. When people are trying to go in the faculty market, oftentimes it can help to have a bit more time because you're kind of validated fresh out of PhD, and so those PhDs tend to be a bit longer. When people want to go to more industry style research, oftentimes they might graduate a little bit earlier because sometimes they're ready and they already have something lined up earlier. So it kind of depends on the path, but we don't have a strict, you have to be here this many days exactly kind of thing. Yeah.
okay. And so I will just answer this other question that came up in the chat on the Q&A. Is there a minimum GPA requirement? So graduate admissions does require that you have a 3.0 GPA, and you can see all of that information on the website. And let's see, I think we have some hands up. Sevi. Oh, I guess we answered your question. Satidya, go ahead and ask your question.
Right now?
Yes, we can hear you.
Okay, man. So my first question is that we tried to reach PIs, but we got no response due to like I don't know what reason. And second question will be to to Dr. Chang. Like we have a research proposal on detecting the public health local outbreaks, so which are really helpful to epidemic hotspot detection. So we are detecting from weather with a new model.
Mhm.
So will you be interested if we tell you for one-on-one meeting?
Yeah, I mean, that does sound very interesting and relevant to my interests. Yeah, I mean, I'm sure Adam and I can both sympathize to this. Or I actually don't, I don't know what your policy is, Adam. Generally, I do try to respond to emails, but I don't usually meet with prospective students ahead of the interview phase, just because, there's a lot of
Actually,
applicants and I
ma'am.
want to be fair to everyone. But I would encourage you to apply and to list my name if that's the area that you're most excited about within health, and I'll review your application. And if it looks like a good fit, then I would reach out for an interview.
Okay, ma'am,
Yeah.
no problem.
I'll add to that. So I like the mental model and the context to have is, every faculty has a very large amount of inbound, basically all the time. We're all struggling to stay afloat with our inboxes. And the way I think about it is, I try to reserve as much time as I can for the students I'm working with, and I have a kind of a limited buffer of time I kind of devote each week for my inbound requests, and I try and I help, but I can only field so many of the emails and like do my best, but like we're all bandwidth constrained. I would not take not a response as a marker of any kind because we will devote a huge amount of time to read all the applications.
Yeah.
So I view when I respond and I take occasionally 15-minute introductory calls as part of my service. I'm trying to help evangelize the field and get people interested in the program and answer questions and help. Those aren't my recruiting process. My recruiting process is the actual interview process. We read everybody at the same time. We get hundreds of people at the same time and kind of so we have so it's fair. And I
Yeah.
try not to do recruiting ahead of time because otherwise I can't manage my bandwidth accordingly. So this is a general thing. Cold emails work better when you make them easier to respond to. So in some senses, like concise and short asks are easier. I try to respond when I can, but I'm fundamentally limited. I think there's a common faculty perspective where you often start off trying to respond to every email, and then you realize you can't do the you can't keep up.
Yeah.
And so that's just the normal game. So don't take it negatively. It's just how this works.
Yeah, exactly. And I think the best way to indicate your interest in the program is to apply and write a really good application and mention the faculty that you want to work with and show why it's a good fit.
Okay, thanks. So another question that came in says, how would you recommend applicants with non-traditional training in programming, data science, and AI to demonstrate those skills in their application?
Talk about it in your application. And basically, it's like if you have a non-traditional background on how you learn these skills, then great. Like talk about the cool things you've done and how you got there despite not having a traditional background. That would be very interesting. I wouldn't worry too much about there's no single story. If there was a single story, it'd actually be bad because then you wouldn't stand out. If you had a non-traditional path, then it was just easier to stand out, right? So just write genuinely about your experience and like what you're excited about and how your experiences led you there, and it'll be a great application.
Yeah, and I think to the extent that you can demonstrate that those skills. So even if you didn't take the classes, if you have some sort of personal project, if you have a GitHub or something, you can demonstrate that you have programming experience there.
Another question is, can you talk more about the program bridge technology gaps between large health systems and community health?
Hmm.
Yeah, so there are many faculty in the AGG that all do different things. So I can give you a great depth on the type of research that I've done in the past, I think my group is doing, but I won't be able to touch every part of that portfolio. So we are running active clinical trials. We have an ongoing clinical trial at SFGH, kind of safety in a hospital. That's not, there's a more ambitious version of that, how do we get care even out of the clinic and do more at-home care. And there's like people who do more of this kind of work than I can answer in full. So I would generally advise if you're interested in like a particular flavor of research that, say, isn't minor students in the call today. Well, there are many faculty and we all write papers. We're all very open about our work. And so find the kind of intersect that most excites you and make sure to name that faculty in your application.
Okay,
Yeah,
I'm
in
gonna go.
terms of, oh, sorry. No, go
Oh,
ahead.
no, go ahead.
Oh, I was just going to say, if it's specific to community health, we are doing a lot in terms of, partnering with public health in the actual area. So, for example, the California Department of Public Health, which is right in the area, is quite interested in collaborating with academics. We have public health impact fellows who are actually at Berkeley, who have a deep relationship with the department, but are also taking classes at Berkeley, and interacting with academics. And so we're basically working on building tools, understanding where the gaps are, how do you actually form relationships with departments, I think part of the challenge is, for example, during the COVID pandemic, a lot of academic labs created tools, but by the time the science was ready, by the time peer review came out, it was too late for decision makers on the spot. And so I think coming up with those deeper relationships, during times when we're not so much in crisis, coming up with those relationships that can be year long, decades long, so that we can actually deliver tools that are both intellectually interesting, scientifically interesting, but also really impactful and hit the actual gaps that they have in decision making.
Another question is, would there be concerns with surveillance and health/genetic data privacy?
Yeah, I think that's a great question. I can speak to that in terms of the sort of data that we use, and then maybe Adam, you can speak more about the genetic data or health data that you use. In our work, we are largely using passively collected aggregated data sources. And so, for example, with location data from cell phones, we use it aggregated up to the level of neighborhoods. So these are census block groups, around 600 to 3,000 people each, and it's only aggregated at that level. So I think it would be hard to identify someone from that. Even with that said, I think there are still important questions around privacy and how to interpret this sort of data to make sure that you're not putting any neighborhoods at risk or any communities at risk of over surveilling anyone. And so I think we are quite careful about aggregation, about anonymization, and also about balancing privacy and utility. And so thinking about what do decision makers actually need in order to make a good decision. They don't really need to know where every individual is going at every moment. They need to have the overall big picture view of how, for example, an infectious disease is spreading so that they can make the decision, so they can fall on the right side of the decision boundary. And so that's the level of accuracy that they need. And so I think being very practical about it and thinking about, actually that practicality gives you some leeway in terms of how much information you need for every individual while still staying very precise at the community level.
Yeah, to add to that on the both just like genetics and like the for the kind of present the style of research that I do, we have lots of individual level health record data where we have someone's medical notes, we have their medical images, and like to access that at all, you need to first get approval to make sure that the study that we're proposing is approved by an institutional review board as ethical and that the risks to the patients, say if there was a data leak, are sufficiently low for the benefit that we're creating. Like if we're either calling patients to get this information, or is it the record review and anonymized records? And there's like this is like something that is fundamental to the clinical research, where our investigators aren't just kind of like we're not just like posting that online and using a random like Google Cloud buckets to access this data applies doing particular types of training, using infrastructure that's locked down by the hospital that has the right level of safety and safeguards around it. And that basic concept of like ethical review for projects is kind of core to the modern clinical research enterprise. So the stakes are high and there is privacy risk, and so we simply have to do work in a way that respects that. But all these things are always questions of trade-offs on what benefit we can create. It's like you don't, I work a lot of medical imaging data. I don't need to know the patient name to work in medical imaging data. So I often work at anonymized versions of the same object because they're just as useful. And so this is something we're very familiar, comfortable navigating. It's core to the research enterprise.
We're going to go ahead and open it up to Sevi. Go ahead and ask your question.
Hi, so thank you all for your advice. I was initially planning to apply to the UC Berkeley and UCSF bioengineering program with a designated emphasis in CPH. Can you talk about what some of the differences in the experience might be? I recognize that there's definitely overlap in the student cohorts.
Yeah, I can get started on that. I mean, like the okay, so there's like first order bit, second order bit kind of stuff when you think about like which PhD program you want to apply to. The first order bit is always like who do you want to work with and who do you want your advisor to be? That's kind of the most important thing. That will define your PhD experience by far the most. Like I have students I advise both in CS and inside CPH. And by far their experience is fairly similar because they work with me and that, like there's a particular type of experience that entails. The second order bit is the actual pedagogy and curriculum that you have, right? Like you join CPH, you're not just working with an advisor, you're part of a community. You have this type of intensive training, and it's not just in computation, but in the health context around it and healthcare shadowing. And how does that type of training align to the kind of research you want to do and that kind of preparation align to your goals and your vision? And that will be different from program to program. Our Cornerstone series are custom designed for the kind of things we're trying to achieve and are not accessible to students in CS or bioengineering. So there are like those are kind of the core trade-offs is like what's your advisor? Who do you want to work with? Because not every advisor admits to every program. And then second order, what curriculum most excites you to support the things you want to do?
Thank you.
Okay, another question is, so I'm very interested in AI-driven clinical decision support. How does the program train students to bridge that last mile from model validation to integration in clinical settings?
Adam, you want to take that?
Sure, yeah. I mean, this is one of practically like there are many things you learn by doing, and many PIs in our program have done this kind of work. Like I have ongoing deployments of GH. We're starting on a clinical trial at UCSF very soon. We have all the approvals ready and laid out. So I have lots of experience now deploying these imaging models into the clinic and having them served up so you can actually act on them. And so all my students will get a flavor of that training because they built models that we're going to deploy next. And so they kind of get that they get that real world experience. And like a great PhD isn't like just the classes, it's doing research, like an apprenticeship within a group. And many people in the institution have been studying this kind of thing. So if you want to understand how to do more EMR-based models, there are folks at UCSF who have already been doing this kind of thing, and there's a huge amount you can kind of learn on the ground. So to do that, though, you actually need to know which problem you're trying to solve, right? So like the pedagogy kind of system, like how do you ask the question and kind of situating you within the broader context, so you can kind of pick the right thing and you get concrete tools. But that true last mile of like how do you get the clinicians on board to do it? You learn by doing. There's no silver bullet.
Okay. So another person asks, I'm particularly interested in applying computational methods to strengthen epidemic intelligence in low resource settings like East Africa. How open is the program to supporting research that focuses on developing or evaluating early outbreak prediction models in global health contexts?
I think very, yeah. I think a lot of us are interested in doing research that's outside of a US context. For example, I have collaborators who are in East Africa. I have collaborators who are in London. I have collaborators in Copenhagen. Um, I might actually point you in particular. This is not so much about early outbreak detection, but this is a project that's led by Meyer Peterson, who is actually our chair. Can I link something in the chat? Is that something everyone can see? Yeah.
Uh, Try it. I don't know
Okay.
that they can, but I can always just send it to them. I will be,
Okay.
we have like over 40 questions, so I will definitely be following up with folks because
Okay.
we are out of time, so we're kind of close. We can take one more question,
Okay.
and then we can just make sure that everyone gets their questions answered afterwards.
Great.
And so we'll send them that link.
Okay. Yeah. Thank you so much.
Let's see. We have one more live question, and then we can conclude. Go ahead, Siddharth.
Yeah, thanks a lot, Bianca. First of all, thanks for the presentation. It's been really nice, and it's just for context. It's 4:30 a.m., so the fact that I haven't yawned is super interesting. But my predicament is also associated with this. What I notice is a lot of PIs in CPH have overlapping interests, right? Just from the presentation example, for example, Dr. Chang mentioned that she works with GNNs, and um, from Dr. Yala's presentation, since multimodal work is involved, I guess a reasonable case can be made for using GNNs as well, right? So just, I don't know, maybe zooming out of research interests, do you have any advice for students to figure out which sort of a PI's group would be a good fit? Just some general advice in that regard. That would be great. Thanks.
Yeah, I don't have a concise answer. It's a lot philosophical. It's like, how do you find what you like? I think there's kind of there is the way I think about it is, every despite we will use overlapping methods and papers or overlapping methods and overlapping ideas because we're part of a community. So obviously, like, we do AI stuff, there'll be AI methods involved in that, the CS training involved in that. Our papers are quite different and we have different things we're trying to achieve. There's different missions in that. There's a unifying theme because we're all part of CPH, but there's a lot of diversity in that. And so like there's no right or wrong thing to be excited by. It's like, what are you excited by? What kinds of, I think something that is often useful is you can look at like the work the students are already doing in terms of the students in different labs and kind of what was the arc was before and after. If we have like a long track record, we have to kind of see this is the kind of theory of impacts and the kind of context they're trying to solve. Every lab has different collaborations and different kind of flavor of things and just spend time reading the papers to kind of see what organically excites you. The other thing I would often recommend, sometimes it's easier to get a hold of a PhD student who does some of this work than it is to get a hold of the professor because the e- email inbox dynamics are qualitatively different. But basically, get to know what inspires you. There's no wrong answer. Just get excited by something.
Yeah, I would agree with that. Yeah, I mean, I think if you look at our websites and especially our recent publications, you'll get a good sense of the kinds of things that we're excited about. And I think actually with CPH having only five core faculty right now, there is a good amount of breadth and separation between the PIs. I do think it's also a good thing in some ways. Like it is good if you apply to a program where there's multiple people that you would want to work with, because you don't know on the other end, how much space they have and whether it's going to work out. And so you can definitely list multiple people on your application if there are multiple people you would be genuinely excited to work with. And I think that's actually a strength.
Thanks a lot. That's really helpful.
Perfect. Well, thank you, Serena, and thank you, Adam, for this presentation. And thank you, everyone, for being here. I will just say that if you are interested in a one-on-one meeting, please reach out to me directly. I am going to be gathering all the questions. Thank you for all those. We had over 40, so we had 42 questions. More actually, because we answered some. So I will be working on those questions and then sending a document to everyone who attended.
Thank you, Bianca.
Of
Thanks, everyone.
course. Thanks, everyone.
All right, bye-bye.